Welcome back. Africa has a higher suicide rate than the global average. How terrifying a stat is that? Experts are linking this to undiagnosed mental health issues like depression and anxiety. The World Health Organization blaming this on stigma and a lack of resources at medical facilities. Adding to that, the emotional stress that depression can also have when it comes to cardiovascular disease. It is very closely linked. Let's speak to an expert, Dr. Mosima Mabunda, Discovery Vitality Head of Wellness. Dr. Mabunda, good to have you back on ENCA with us as well. Why is there still a stigma, do you think, about mental health? So many people do have mental concerns to some degree or another. Why is there still such a stigma, do you think? Morning.
Morning, Gareth, and good morning to your viewers. Thank you for having me, but I think most importantly, let me thank you and ENCA management for actually doing your part to raise awareness and actually break the stigma on mental health conditions. On your specific question on why is there stigma, I mean, the jury is out there, but we know that people in the public tend to think of mental health disorders as maybe a bout of the blues or something that one can snap out of. Sometimes you hear people thinking that it is something that people cause upon themselves. But actually, I think what this day is meant to do is actually make people realize that those are just stigmas and myth. Mental health conditions are medical disorders. It's not a bout of blues. It's not something that someone causes upon themselves. It is a medical condition, which is why days like today are actually important. And I think the reason why like this interview is actually quite important is these things are quite common, not only in South Africa and across the globe, right? You have at least 1 in 8 people across the globe living with mental health conditions. And in South Africa, that can come to at least 30% of South Africans that are living with a mental health disorder or will do at some point in their lives. So I think it's important that people realize it's a mental health condition. It can happen to everyone. And because common things happen commonly, I think it would be remiss for me to actually not shine a spotlight on depression specifically.
Yeah, I want to talk about that as well, Doctor. It was October 10th, which is today. I didn't mention this in my introduction. It's obviously World Mental Health Awareness Day as well, because a lot of people went through a lot of trauma, especially during the COVID-19, and we saw a jump in depression and anxiety as a result of that. As a medical aid, as a medical company, how does Discovery view treating somebody with depression and anxiety? What's the view and how it should be handled by professionals?
So before I get into that, I think just for the benefit of the viewers, it's important to outline what do we mean when we say someone has depression, right? So depression is a mood disorder. It causes a persistent feeling of sadness and loss of interest in activities of daily living. In essence, it affects how you feel, how you think, and ultimately how you behave. I'm raising this because people have different views on what depression is. And your question on how does Discovery think of treatment is actually quite important, but you can't treat without screening. The sad thing about depression and mental health disorders is they often go untreated and undiagnosed, which is why how we approach it as a group is within Vitality, we use incentives to motivate members to screen, because we know that people generally are not motivated to go and screen, especially when they don't think something is wrong with them. Because some of these things are either asymptomatic or you're misreading the symptoms. So the power of incentives of getting people like Mosima to actually do things that are right for their health, which is screening. And I'm highlighting screening and why incentives are important, because what we see in our data is when people do depression screening, for example, and the score suggests that they've got moderate to severe symptoms of depression, those people are actually highly likely to connect to care. They're 3.3 times more likely to now go seek out a psychologist or go seek out a psychiatrist, which is why screening is important, because it facilitates linkages to care. So we think about it holistically and we realize that it is actually important to proactively screen. And I want to nudge anyone who is a practicing clinician that if you see anyone who's a Discovery member, especially if they're a Vitality member, they are likely to have screened. They're likely to actually have results of their depression screening.
And it's almost like having this network of information, Dr. Mabunda, because I want to, as I say goodbye to you, you've spoken about the mental aspect of this. I want very briefly from you, if you don't mind, there's also a physical element to this as well. It can be linked to comorbidities and even also cardiovascular disease. Tell me about that quickly.
Thank you for raising that. So not only screening important, but it's screening in people with comorbidities, especially cardiovascular diseases, as you mentioned. We've just come off of Heart Awareness Month in September, where the importance of heart conditions are raised. But we know that at least 1 in 5 people that have cardiovascular conditions have depression. So these two conditions actually happen together. And how we approach it in Discovery is the relationship is actually bi-directional. So what is important is when you're approaching a patient with comorbidities, you must make screening a priority for other conditions. Someone with cardiovascular conditions, it's important to screen for depression. Someone with depression, it's equally important to screen for cardiovascular conditions. In our world, we've thus made the Vitality Health Check a central tenet of the Vitality program, where to unlock the rich rewards across our partner ecosystem, you need to actually complete your Vitality Health Check. And what that does is it creates standardized pathway that doesn't rely on Mosima knowing that, oh, now I'm at risk of this, I must do that. But we create standardized screening pathways and we tag rewards because we know it's important for people to proactively screen before it's a bit too late.
And as you say, the incentives also so very, very important as well. It's a good way for people to be actually going out and screening as well. Dr. Mosima Mabunda, Discovery Vitality Head of Wellness. It is Mental Health Awareness Day. Go get screened. Doctor, always good to talk to you. I'm sure we'll touch base again perhaps later this month.